from the desk of the medical team of St. Lawrence Catholic Church, Isheri, Orofi, Lagos. My name is Dr. Chukwemeka Mugu. I am here to discuss male urinary tract with reference to the prostate gland. As we talk about days back, that this thing wasn't so common then, but why is it common now? So because of that, we now said, we analyze the people who eat refined foods are having more of this. From some research carried out, we've discovered people who are eating refined food have more of this. Like in this our environment, Nigeria in particular, people who will feed on natural food, like eat our natural meal, amala, ewedu, ugu, fufu, gari, those things that we eat there that are not having preservative are very, very safe from these problems. So those who have decided to drink refined fruits, like the fruit juice that we get from cans and so on and so forth, people who smoke, people who take refined alcohol, mostly a lot of alcohol, even some people take ethanol now, those people are risky of developing this situation. Now, at what age do men start checking for prostate issues, getting worried? From 40 years, as I said, that's when the prostate starts growing. Unlike any other tissue in the body, it starts growing from 40 years. So, and then, yes, of course, there is a quite difference between benign prostatic hyperplasia. When we say benign prostatic hyperplasia, what we are talking about, which is BPH, what we are talking about is multiplication of the cells, unnecessary multiplication of the cells of the prostate, making it to be bigger than normal. As I said, it should be plus or minus 2 grams. You will not see somebody prostate 20 grams. You see somebody's prostate that will be 45, 50, 60, 100 grams. That is benign prostatic hyperplasia. Now, cancer is another one. The cancer one is, is abnormal cell multiplication. The cells are distorted and can now send signals, which doctors will call metastasis. It can move from one place and causing problems. Like when it is cancer, you'll be seeing that the person might not be able to move. It has made a deposit at the bone at the back. We call the vertebra column. It can send to the skull bone. These are the painful places it sends first. So in that situation, the cancer is different from BPH. So, okay, how can diet and lifestyle, which is what I just said, when you live a life of eating on preservatives, feeding on things that contain preservative, mostly in this part of the world, categorically I want to say here, some is not working. That is Standard Organization of Nigeria. They are not working. NAFDAC is not working. These people are not doing their job diligently. Their labs are just there. Sometimes when the federal government allocate money for them to do research and be sure of what the people are consuming, they will just collect money from the so-called importers, manufacturers, and so on and so forth, and be giving us anything that goes, anything that comes from China, anything that comes from any part of the world comes in freely and we consume. Those type of, and those people who consume it are those who have high social economic status, and they are the ones that are more affected. The poor masses that are feeding from the farm, the peasant farmers, hardly do you see them come down with prostate problems. Thank you. Yeah, then what is involved in prostate examination? You see, it is a simple thing. You get, number one, when you see all these symptoms, you cannot easily urinate. You see, there's a symptom that every time we keep on going to doctor, it seems I have typhoid and malaria. It seems I have typhoid and malaria. I don't know. It has become a classical thing in this part of the world. Typhoid and malaria. Sometimes it is prostate, giving you a fever, a very serious fever, because there is stasis in the blood. There is trap. Urine has been trapped. Bacteria has grown in the urine. Go around, start throwing pH to the blood, because a point will reach, which is towards the end stage of BPH or cancer. The person will be passing blood in his urine. So some blood vessels have been ruptured in the bladder. This bacteria will find themselves into the blood vessels. They will enter into the blood vessels and now cause sometimes sepsis. That is infection in more than one organ. It will go to the kidney. You will have infection there. That will give you fever. Even infection in one organ will give you fever. So in this situation, what are we to do when you come to the hospital? Number one, the doctors who call urologists, can put hand, even ordinary doctor, put hand into your anus and what we call anal examination. Put hand into the anus of the man, feel the prostate. If it is so smooth and you know that there is a BPH. If it is a bit rough, that's rough, like it's stony and so on. But that one is for we the doctors. It's not for you to consume. You know that it will be cancerous. So in this situation, we move on. And then, which other thing can you do? Yeah, because when it happens, it will affect the kidney first. Because if you see the diagram, I want to show you the diagram. If there is a problem with can I see the diagram? If there is a problem with the prostate here, if there is a problem, it will tighten that pipe, and there will be what we call obstruction of urine going. And this, instead of urine to be going down like this, it will store, and finally it will get to the what? To the kidney. And they will also what called hydronephrosis. To the kidney will swell up. In this situation, what do we expect at this moment? That's something I want to say now. In this situation, the kidney will start being sick. The kidney functions will start falling. And how do we know? How would the doctor know what the extent we will do EU creatinine? What do we mean by EU creatinine? Electrolyte, urine, and creatinine. We check their measures. We know their measures in the hospital. Again, what do we do again? We do ultrasound scan of this region. We do a ultrasound scan, to see what is happening in that place. Look at the prostate, look at the bladder. At the same time, as the situation is advancing and going on, you can as well subject to CT scan to see better also. So we have many other. We should also, infection also. We can now do, if the urine that is coming, you can culture. You culture the urine and know the infections that are there. At least when you do ultrasound scan, you will see whether there is a stone. You will see the level of the obstruction. When you do CT scan, you will see better too. And even MRI, we can subject the patient to MRI depending on the intensity of the obstruction. So, and that's it. So this tests, we can do it, even full blood count. Then in this situation, then every man that is above 40 years, I advise the person to be doing what we call prostate-specific antigen. This is a tumor marker. We call it tumor marker. It is that's a medical term. It is something we used to target and check: is this person about to have a prostate problem? Is it going to be cancerous prostate? Is this prostate becoming cancerous? Is it enlarged? Is it cancerous or not? This man will tell us if it is cancerous or not. So PS is supposed to be between 0 to 4. If it is above 4, the person should know that it's becoming a problem. So in that situation, and you should do this PSA at least from 40 years, every 6 months you do. every 6 months. But as you're getting older, you can now, from 60 years, you can reduce it to 3 months, and that should be it. So, how do we treat this, let's say, BPH? The commonest way to treat BPH, that is benign prostatic hyperplasia, the simplest way is we do medical treatment. We apply medical treatment where some drugs that will help to stop the conversions of that hormone I mentioned before, can slow it down and make sure that the growth is not so much. It's no longer going and actually slow down the growth. Another thing is this. The cancer aspect of it. If the person has cancer, we do chemotherapy, we do this and that. But specifically, to solve BPH, mostly definitive treatment is surgical. We resect by chopping off some parts of the prostate. We chop it off. And that surgery, I want to see a diagram of the respiratory system where I can see the testes. So in that situation, you will see that the fear of surgery of most people is that after the surgery they become impotent, they become sterile, they cannot be able to pregnant a woman. That's always a fear. Yes, this diagram. Thank you. You see here, this is the testis. This is where the ejaculation comes from, and it moves into the same prostate. So it joins the urethra and the bubble urethra. That's what we call the place. There's a point in the urethra where that the thing will join with the urine. So if the surgery is going on, the urologist must be very careful. The urologist must be very careful to make sure that they do not cut into this duct. We call it the vasa deferens. You don't cut it. That is the sperm duct, where the sperm will come from. You don't affect it. It is always done this time around without affecting this, so that the ejaculation will always come through the urethra to the outside environment. But if anything happens that during the surgery, the definitive treatment, which is surgical, if anything here affects it, if anything here, as you are trying to cut off a chunk of the prostate that is giving problem, when you want to cut it off and you cut along with this, then the patient can become impotent. That the person will be having ejaculation. It will go into the bladder, and only when the person urinates, the sperm or semen will come down with the urine. And in that situation, the patient will not be able to pregnant the wife. So based on this, we can see this is a brief problems the prostate can impose on a man when it has a problem. This is generally is worrying men of this generation, is of concern to men. So in this situation, we thank every one of you, and we hope you have to share this our video, listen and share, and try as much as possible to pick one or two things here that we have just said. Mostly, the lifestyle should be better. Be more organic in your feeding. Feed on fresh vegetables and fresh fruits, and feed very much organic. Thank you.